Hello, and thank you for joining us on the Mayor's Forum. I'm Mary Rassicott, filling in for Mayor Lukes until after the election, and with me is Mike Portuphy. He will describe himself in a moment. Tonight we're going to be talking about infant mortality and the really serious problem that is in the Worcester area. Mike is an expert on the subject, which is why we have him here with us today. And Mike, tell us who you are. Give us your whole long title.
I'll probably make it just something very brief.
Okay.
I'm Mike Portuphy, like you've rightly mentioned. I'm the program director for the Worcester Health Disparities initiative. I'm also a staff on the Worcester Infant Mortality Reduction Task Force. That's a very long name, yes. I know. I've worked with maternal and child health issues for long abroad and here in the United States. And I like to talk about the problem in the city.
Yes. Now, September is Infant Mortality Month, is that correct?
Yes, it is. And we are really doing so many activities in the city right now to increase awareness about the problem of infant mortality. Actually, Congress has approved that the month of September should be observed as the National Infant Mortality Awareness Month nationwide. And so all healthy starts nationwide are involved in engaging the community about the problem of infant mortality.
You know, I'm embarrassed to say I didn't realize that infant mortality in Worcester was such a huge problem. Explain to me why there are so many babies dying in Worcester.
First of all, I'll talk about the problem in Worcester.
Okay.
Like you've rightly said, infant mortality is a very serious problem in the city of Worcester. And for the sake of our audience, I would say that infant mortality refers to the number of babies who die in any given year per 1,000 live births. So any baby who dies under the age of 1 is counted among the rate or the infant mortality rate for that region in any given time period. So for the city of Worcester, the main problem is that the rate has been consistently high in the past 20 years, and the rate has stood higher than that of the state. And so that is a very key problem that ought to be addressed. It's not a problem of any one individual or any particular agency. It's a citywide problem, and everybody would have to look at it that way. One thing I would say about the rates in terms of data is that the rate for the city of Worcester stands at 13.9 per 1,000 live births, and this was the rate for 2005. Right. And when you compare that to the state, and the entire state has a rate of 5.1 per 1,000 live births. So as you can see, Worcester has a problem, and we all have to identify, be aware of that problem, and begin to do the things that are necessary to address this problem.
One of my questions for you earlier was, are the statistics skewed because so many babies from surrounding towns, Western Massachusetts, North and South, come to Worcester to have, you know, high-risk babies? We have some excellent hospitals, some great physicians. Can these statistics be skewed because so many people are coming here to have their high-risk babies, as opposed to going all the way, well, 45 minutes to Boston?
Yeah, that could be a factor. Mm-hmm. But one of the things I would say is that the rate is high for all races in the city of Worcester.
Okay.
That said, there is also the need to understand that the rate is also highly pronounced along racial lines.
Okay.
You look at, for example, the infant mortality rate in the past few years, and for the city of Worcester, as we have it, has its residents has about 7% of the entire population being blacks. But out of this 7%, we have about between 17 and 55% of the infant mortality problem attributed to the black population. Now, given this population, we also have among this population between 50 to 100% of all mothers as part of this group being responsible for the infant deaths that we observe. And the mothers we are talking about are immigrant mothers. Most of them are women who have come from West Africa and other parts of the continent of Africa. So the problem is very pronounced among the black population.
Are they arriving here already pregnant, having not had any prenatal care, poor food, or?
That could be a factor. Some of them come in their second or third trimester.
Oh my.
And so this is one of the more reasons why a lot of outreach and awareness has to be carried out in the city to get these women to seek prenatal care early when they come into the country.
Now, Great Brook, where you're working, has a fabulous program prenatally. 300 workers, you address 29 different languages. It sounds like a fabulous program. Do these women not know that you're there, or is it just a matter of getting them there?
They are coming in and we are getting them. A lot of efforts are going on. But in Great Brook Valley, one of the programs that we have initiated, in fact, Great Brook Valley is the grantee of this program, and that is the Worcester Healthy Start Initiative. This is a citywide program, and we work with other sites in the city. We work with UMass, we work with Pene, and we also work with the Family Health Center of Worcester. We have case managers who are located across the city, and they provide complementary services to what the doctors are providing. And so I will talk about our case management model in a minute. But to answer your question, we are reaching out to these women. Currently, we have quite a number of them who are still coming in, and we are getting to them. But there is still much more that has to be done. And I know other clinics are also involved in reaching out to these women.
Do you have any charts or any descriptions of what the babies are dying of? We always think of shaken baby syndrome or different abuse types of deaths. Are these babies premature, or what are the reasons for so many babies dying?
Yeah, with regards to the causes, there is still ongoing research to find out the actual causes of death for these babies. But one of the things is that we believe that there are risk factors that could result in the death of a baby. We can talk about individual risk factors. We can also talk about environmental risk factors. Environmental factors could be inadequate housing. Homelessness can contribute to poor health for the mother and poor health for the baby. And also exposure to secondhand smoke is one of the problems. So when the women inhale or are exposed to this secondhand smoke, it results in many problems for the fetus, which could cause problems such as fetal alcohol syndrome. But also, when it comes to the individual, we consider the behavior of the woman long before birth as very, very important to the health of the baby. One of the messages that Worcester Healthy Start carries across the city is that the health of a baby begins long before pregnancy. And so the behavior of the woman is very, very important when it comes to the health of that baby. Now, the baby stays in the womb for about 9 months. And during that 9 months, the baby is staying in a protected environment. But then, whatever the woman takes in can affect that baby. If that woman smokes, that woman is involved in taking alcohol, using drugs, and is taking in things that are harmful, those could affect the health of that baby. So all these factors are contributing factors. But then the medically proven factors are two, which we currently know could result in infant mortality. And these are preterm factors, which is babies being born too early. And also some of them are born too small. So the factors are two main things. They are being born too early and they are being born too small. Right. Preterm birth and low birth weight.
I still don't understand why Worcester has so many.
Yeah,
that's perplexing.
Yeah, it is. It is very perplexing. And I have something to show. What some kind of data here. It's a graph that I would show to. I wanted to. You may be interested in taking a look at this. When we look at this graph, you can see that the rate is the red line represents the rate in the city of Worcester. And so you look at it and compare it to the rate of the state. The rate of the state is fairly constant. Yeah. But you see that the rate of the city of Worcester is quite high, very high. And in 2005, it was higher than it's ever been.
Shot rate, oh, yeah.
So this is a problem, and that is why the whole city would have to come to the table to address the problem. The Worcester Infant Mortality Reduction Task Force and the Worcester Healthy Start Initiative are spearheading several efforts to create awareness and to bring people to that awareness that there is a problem, and we have to be able to address the contributing factors to this problem. But we still need the entire city to join us in this dialogue, in these discussions to address the problem, because one individual can't solve this problem. One agency can't solve the problem.
That's right. We're going to take a very brief break and come back in just a moment to continue our discussion on infant mortality in Worcester. Thank you for joining us.
The Solidarity pays for East African women to go to secondary school and earn their high school diploma.
What used to be a sprawling 70-foot Norway maple tree was diminished to piles of wood on Thursday.
The Wachusett Mountaineers are young, but they figure to compete in the very tough Division I North.
Josh Smith joined candidate Sam Rosario and retired firefighter Joe Casello.
Hannah Ray Stevenson, born April 12, 2007. You definitely have Amy's eyes. Hey, sweetie.
Download what you want faster. Bring your home to life with Charter high-speed internet. Surf at amazing speeds and more for one low monthly price. Call 1-877-SAVE-190 today.
WCTR TV3, a 7-time winner at the 2007 New England Cable Television Association Excellence in Cable Television Awards.
Leadership is about getting people in the room, setting goals and objectives and priorities, and getting solutions.
Does your teddy bear have a boo-boo?
Now you don't have to miss any of Charter's original local programming with Local on Demand.
The award-winning Charter's Channel 3 television for Central Massachusetts from Central Massachusetts.
Thank you for joining us and welcome back to the Mayor's Forum. I'm Mary Rassicott and with me tonight is Mike Portuphy, and we're discussing infant mortality in Worcester and what a serious, serious condition it is. Mike, I'd like to continue on where we were going and tell me what is being done and what are your initiatives as far as helping with this really serious problem in Worcester.
One of the things we are doing is that we are implementing what we call a case management model that we got the guidelines from the National Association of Obstetricians. And so this case management model is a kind of model that provides complementary services that will help support what medical providers are giving. The reason for that is that we realize that the time frame within which a doctor meets with a patient is so short, such that it would be almost impossible for that medical provider, that doctor, to be able to identify all the problems around a pregnant woman and solve and provide solutions within that given period. And so what we are doing is that we are reaching out to the women early in their pregnancy, providing them with early information about how their health behavior plays a role or how their health behavior affects their babies. And so we are providing these complementary services as something that should support what the medical doctors are doing. And it is proving that our efforts are working. Actually, for Worcester Health Start, we are one of the very few agencies that is involved in identifying all infant deaths in the city of Worcester, even before the state releases their data. We have hired a gynecologist, Dr. Dale McGee, who is helping us with identifying or reviewing the infant deaths in the city, so that prior to the state releasing its data, we already know what is going on in the city as far as infant deaths is concerned, and we begin to take measures to be able to address the problem. And so the case management model is working. It's a citywide program, and Health Start is doing a lot to be able to help these women. Over the time of its inception, we've been able to address the problems of up to between 6,000 and 7,000 women since the program started. And so a lot is going on. But also, we work with the task force, the Worcester Infant Mortality Reduction Task Force. This is a very strong, powerful team that was initiated by the idea of Zoila Feldman. And there is a lot going on at that level also. The Worcester Infant Mortality Reduction Task Force collaborates closely with the Worcester Health Start initiative to carry out campaigns in the city, which is ultimately aimed toward eliminating racial disparities and improving birth outcomes. So we are doing quite a lot in the city.
Now, for the average person watching tonight, what's something that they could do to become involved, to help pregnant women, to help this whole incredibly huge problem of infant mortality?
Number one, we want everyone to carry the message to all mothers and women who are not yet pregnant and are planning a pregnancy that the health of their baby begins long before pregnancy. And so their health is very, very crucial. They should be involved in exercising, eating healthy, avoiding smoking. Don't expose yourself to secondhand smoke. carry out those activities that would make you have improved health. Don't assume that when you get pregnant, that is when you begin to take good care of your health. Because if you are healthy prior to pregnancy, it affects the health of your baby. So we want everybody to have that message on the fingertips. And also, we encourage people to seek for prenatal care very early in their pregnancy. Very early. Don't wait until you're in your second trimester or in your third trimester. That will be a problem. And so this is the message that we are carrying out. And we encourage people to call the Worcester Healthy Start Initiative. And we are ready to help anybody who is pregnant and needs any counseling as far as pregnancy issues and birth outcomes is concerned.
And so this would include the family as well, the father of the baby or the family members of a young girl, because the numbers were frightening how young these girls are when they're becoming pregnant.
Exactly. And
they need support.
They need support. So we have some home visiting that some of our case managers do. The case managers do some home visiting, and they are able to provide education to the entire family if there is a need for that, as far as healthy habits is concerned. As with regards to our impact on our participants, I would like to show this slide. As you can see on this slide, for the Worcester Healthy Start Initiative, from the period of 2000 to 2005, the infant mortality rate for our participants is 5.7 per 1,000 live births. When you compare that to the city of Worcester, Worcester is standing at 8.6, which is very, very high. And then the state of Massachusetts is 4.9 per 1,000 live births. But the point I want to bring here is that we have been able to reduce the infant mortality rate of the program participants, as many as enroll in our program. And we believe that a lot more can be done to help these numbers go down. And I see this as even more significant because our population are very high-risk population. One of the things we do is that we use GIS to identify census tracts in the city of Worcester.
What's GIS?
Geographic Information System.
Thank you.
We do some kind of geocoding, and that enables us identify the census tracts in the city that have the highest infant mortality rates. When we identify those census tracts, we concentrate our resources on those census tracts. We increase outreach on those census tracts, and we try to get the residents of those areas into prenatal care even before and during their period of pregnancy.
That's wonderful. Now, do you find that women don't want to become involved, or they just don't want to deal with their pregnancies, or are the women that you're dealing with pretty anxious to get the help that you're offering them?
They are very much appreciative of the help that we are offering them. One of the things our case managers do, and we have a fabulous team of case. I'm very proud of these case managers. One day I should invite you to meet with them. But
I would love it.
Sure. But one thing they do is that they conduct psychosocial risk assessments. And these assessments identifies the social problems of each client that comes in. And when the case managers begin providing the help to these clients, they are very appreciative. They are very appreciative. So the word is out there. The women are coming, but we still need more support. We still need the city to get involved and help us reach out the more to the clients that are most at risk.
How do they reach you?
We have our number that we have on our brochures. Our brochures are circulated all across the city. We have a fabulous outreach team that distribute our brochures in strategic locations, in the saloons, in many places across the city, to be able to get women. When these women visit those places, they get our brochures, get our numbers, and they call in. Also, when they visit the health centers, they are able to get enrolled into the program because nurses and other doctors keep referring people into the program.
Thank you so much, Mike. You're doing a fabulous, fabulous job. And I hope that all of our listeners will become more involved and be more aware of what's happening with infant mortality and to send young ladies to you to get the help that they need.
Thank you very much. And one thing I would mention before we leave, National Infant Mortality Awareness Month is September. And Healthy Start and the Worcester Infant Mortality Reduction Task Force is working around. Look out for flyers and join us to celebrate that month.
Thank you very much. And thank you for joining us tonight on Mayor's Forum.
Choose a cut of meat with good marbling. Then cut it into 3 pieces so it will fit nicely in the roasting pan that we'll be using later. Now, using a special dry rub, work the seasoning in.
A picture so good, you can taste it. Bring your home to life with Charter HD TV and get the HD programming you really want to watch. Try it risk-free for 30 days. Call 1-877-SAVE-190 today.
Hey, did you hear the news? The Fallon 5K is back. We got a new name and a new course.
Follow the path of historic Blackstone Canal through the streets of Worcester.
Be a part of the inaugural Canal Diggers 5K on September 16th, right here in our canal district. So join us on September 16th for the Canal Diggers 5K. I don't know about these guys, but I'll be ready. Let's go.
That's all right. I don't mind. Some of us have to go back to work anyway. I could beat him with my suit on anyway.
Leadership is about getting people in the room, setting goals and objectives and priorities, and getting solutions. If you don't know that about Worcester, what do you know about Holyoke, or Pittsfield, or Lawrence, or Lowell, or Fall River, and New Bedford?
Get your State House connection with Lieutenant Governor Tim Murray exclusively on Charter's Channel 3.
Welcome back to the Mayor's Forum. We've decided to keep Mike a little longer tonight because the discussion is so interesting. My name is Mary and I'm filling in for Mayor Lukes, and this is Mike Portuphy, and we're discussing infant mortality. Mike, give us some recommendations.
Before I give the recommendation, one of the things I would say is that it is very important for women to plan their pregnancies. And also, when you plan your pregnancy, ensure that you have enough time in between pregnancies.
Wow.
And within that time, it is necessary to seek for interconceptional care. The Worcester Health District provides some kind of interconceptional care for women who are in between two pregnancies. If you've given birth and you are still waiting to give birth another time, we expect that there should be quite some time in between that. One of the things we will recommend is that everybody should get involved in the move to reduce infant mortality in the city. We want the city to dedicate resources to increase outreach in the city so that people will be made much more aware. We need campaigns that would enable people to know and understand that smoking is not right for pregnant women. We need campaigns to make people understand that alcohol use is not accepted during pregnancy because you take in alcohol and it affects your baby. People ought to begin to accept the fact that exercising and eating well is very vital. Whatever you do today would affect the long-term health of your baby. Your baby grows, and if you adopt these healthy behaviors, your baby grows very healthy. Otherwise, there are so many problems that could come as your baby grows up, and you wouldn't want to face those problems.
Yes, yes. One of the questions I had for you, Mike, was birth control. I mean, we have all these babies and very young girls having babies. Is there birth control available for the young ones? A lot of boys don't like to use birth control, but for the young girls who want to take control of their own bodies and don't want to have unwanted pregnancies, are you addressing that issue sort of before the pregnancy?
Yes. One of the things our case managers do in the city is that they provide family planning services to all our clients, and that includes birth control. And I look at the services that they provide, and we are beginning to believe that it is very necessary. Now, this is one recommendation, very vital, that the healthcare system in the city of Worcester adopt the case management model as an integral part of its service delivery. If all the healthcare providers, all the clinics, hospitals in this city will adopt this case management model and make it an integral part of the services being provided, it will go a long way to help. Because with that, the services that the doctor cannot provide because he has very limited time, the case managers are readily around to help these women.
That's amazing. It sounds like a fabulous program. What needs to be done now?
Number one, we want, like I said earlier on, the city should dedicate some more resources to outreach. We also want the city to support the efforts of the Worcester Infant Mortality Reduction Task Force and the efforts of Worcester Health District Initiative. There are other programs also in the city that are working towards improving the health of families. Attention should be given to these programs, and they should be supported in one way or the other to enable them be sustainable, to enable them reach out to more people. Collaboration is very key to eliminating racial disparities in the city. If we will all collaborate and come together and identify the causes and put the resources resources on the table, I believe that we will go a long way to eliminate this problem. Many cities have been able to bring down their rates drastically, and I believe Worcester can do the same thing.
It's very encouraging. Is there anything that's being done? You talk about your caseworkers going into the families, the girls' home. Is there anything that's being done to address the young men involved in this? It seems it's always little girls. You know, you see all over Worcester where there are strollers, very often a mother in tow. What's being done to make the young men accountable to care for the wives or the girls and their babies? Is anything being done to address that issue?
The male component is one area we are thinking about right now. Okay. We haven't really initiated a male component of our program, but as much as we can, when our outreach workers meet with the partners of our clients, they give them some education on the importance of providing support to their partners. Also, during our community consortium meetings, whenever a male comes in, we make them feel good, and we encourage them to understand that it is important to support your partner and to help your partner throughout the period of pregnancy. And so we are still contemplating on encouraging men and getting more men involved in the process.
Yes, because even secondhand smoke, alcohol, if he's smoking, if he's drinking around a young girl who's pregnant, that's pretty tough.
It is.
So in a sense, he needs to also step up and think of the pregnancy as being both of theirs.
That is true. That is true. It's a family problem. That is my approach. I see infant mortality as not just a women problem, but it is a family problem. The entire family would have to get involved and help the woman maintain healthy habits. When the woman maintains healthy habits, it goes a long way to improve the birth of the baby.
And also, if the infant mortality is up to 1 year after birth, that's that first year of growth for that baby that it needs to be protected.
Yes, that is true. But one of our observations is that the babies who are under the age of 28 are dying much more than any other category. That's the neonatal period. The neonatal period from childbirth till the baby is 28 days old. Most of the infant deaths are happening within that period, and we're still trying to figure out what the causes are. Although we know, like I said earlier on, that preterm birth and low birth weight are contributory factors to that.
28 days.
28 days. 28 days. And one of the recent observations, like in 2005, I said the rate was very high, 13.9 per 1,000 live births in 2005. One of the causes was multiple births, babies being born as twins.
Yes.
In fact, I think about 6 of the pregnancies had twin babies, and most of the deaths came from that. And
you're doing a fantastic job, Mike.
Thank you.
Thank you for your incredible work for this, for the City of Worcester, for all the moms and the babies. And thank you for joining us on the Mayor's Forum. And we will join you again next week. And we hope that everybody in Worcester will really gather around to help the babies in Worcester survive in this wonderful city. Thank you for joining us.
Thank you for having me.
Welcome and thank you for joining us on the Mayor's Forum. My name is Mary Rassicott and I'm filling in for Mayor Connie Lukes today. And with me, our guests this evening are Lance McKee and Peter Wingate. Our topic today is one that's very